Does this sound familiar to you? It's nearly 3 a.m. You find yourself forced to leave your warm bed, walking with heavy, stumbling steps toward the bathroom. And this isn't the first time tonight. Maybe it's the second, or even the third. These repeated wake-ups don't just steal your sleep. They steal your energy, your mental clarity, and your vitality for the next day. You feel your mood shift, your body feels heavier, your mind slower. And as you try to return to sleep, you hear your spouse sleeping deeply beside you, as if nothing happened. You ask yourself, why me? Is this normal as I get older? Many people believe this is inevitable with aging, so they surrender to chronic fatigue, to the fear of stumbling in the dark, convincing themselves that uninterrupted sleep is a thing of the past. But the truth, and I'm telling you this clearly, is that you don't have to live this way. No one is forced to spend their nights with broken sleep and their days exhausted. I'm Dr. Naraya Wolf, a specialist in urological health and bladder problems. I've spent over 10 years dealing with this issue that thousands of men and women in their 50s, 60s, and beyond suffer from. I've listened to many stories filled with frustration, but I've also witnessed incredible transformations in my patients' lives. And if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, I won't share generic tips or surface-level solutions. Instead, I'll reveal to you a precise, science-backed strategy about how and when to drink water so you can reclaim your deep sleep and wake up full of energy. It's a simple, logical strategy, and yet so many people ignore it. In fact, after learning it, you'll wonder, why didn't anyone tell me this before? Stay with me, because the information you're about to hear could change not just your nights, but your entire life. We call this disorder nocturia, the repeated awakening to urinate during the night. It's what we sometimes call the silent epidemic. Why silent? Because most people suffer from it in silence. They feel embarrassed or simply surrender to it, quietly. But in my clinic, I hear the real, moving stories that reveal just how big this problem is. For instance, I heard the story of Mr. Ahmed, a 70-year-old man who loved the hobby of making tiny ships inside glass bottles. But he had to stop because his hands were shaking from the exhaustion caused by lack of sleep. Or Mrs. Fatima, a retired 63-year-old teacher who suffered a painful fall during one of her nighttime trips to the bathroom, resulting in a hip fracture that nearly cost her her independence. These aren't just stories. They're painful realities faced by many older adults. Let's clarify the hidden dangers of this disorder. 1. Risk of falls and injuries. In the dark, half asleep, your balance becomes very weak. The path to the bathroom is full of obstacles. A rug here, a piece of furniture there. A simple fall could cost you your daily life and independence, especially if your hip is injured. 2. Impact on brain health. Deep sleep isn't a luxury, it's a necessity. During sleep, the brain clears out toxins and consolidates memories. When your sleep is interrupted night after night, this process doesn't happen fully. The result? Mental fog, difficulty concentrating, memory weakness, and increased risk of neurological diseases as you age. 3. Pressure on the heart. Every time you suddenly wake up, your body releases stress hormones. Blood pressure and heart rate rise. If this happens repeatedly, you're putting your cardiovascular system under constant pressure. Medical studies link severe nocturia with high blood pressure and other heart problems. 4. Psychological and emotional impact. Chronic exhaustion robs you of joy. It makes you irritable, increases anxiety, and can lead to depression. You feel your social life is affected, that you're isolating yourself from loved ones. Why does this happen with aging? There are several main reasons. First, the body's production of antidiuretic hormone, ADH, decreases at night. This hormone tells the kidneys to reduce urine production during sleep. Its deficiency makes the kidneys work all night long. Second, the bladder's capacity to hold urine may decrease. Third, and what many people don't know, fluid redistribution in the body. If your feet are slightly swollen during the day, these fluids return to the blood when you lie down and pass through the kidneys to reach the bladder, waking you up after just a few hours. Now that you understand the seriousness of the issue and the science behind it, in the next section, we'll begin breaking down common mistakes and building the solution. I'll reveal the errors that might make the problem worse, then the correct way to restore your full sleep. To reclaim your deep sleep, we must first stop what's wrong. Many people with good intentions engage in behaviors that worsen the nocturia problem instead of solving it. Let's uncover 3 of the most common mistakes. Mistake number 1, drinking as little water as possible to avoid nighttime urination. Sounds logical, right? The less you drink, the less you urinate. But your body isn't that simple. When you become dehydrated during the day, your urine becomes very concentrated. This concentrated urine irritates the bladder wall. Imagine it like pouring lemon juice on a small wound. It's painful and makes the bladder send signals. Go to the bathroom now, even if it's not full. What's more, when you drink in the evening after deprivation, your body tries to compensate for all the fluids at once, and this often happens during the night. The paradox: drinking less during the day may lead to more nighttime awakenings. Mistake number 2, believing the problem is a small bladder. Some people think they have a small bladder, and this is something natural they must live with. The truth? Usually the problem isn't the bladder size, but kidney urine production during the night. As I mentioned earlier, ADH hormone deficiency and fluid redistribution from the legs are the real culprits. Even if your bladder were very large, if the kidneys keep producing urine, you'll wake up every night. Believing the problem is only the bladder prevents you from addressing the true root cause. Mistake number 3, drinking alcohol. Before bed, alcoholic beverages act as powerful diuretics. They also inhibit ADH hormone secretion, the one responsible for reducing urine production during sleep, leading to increased nighttime urination. It doesn't stop there. They also weaken sleep quality and make you wake up more in the second half of the night, exactly when the bladder starts sending the signal. Time to go to the bathroom. The most important advice: if you want deeper sleep and less nighttime urination, avoid these drinks completely. Choose healthy, warm alternatives or soothing herbal infusions before bed. Now that we know what not to do, we've prepared the ground to reach an effective solution. In the 3rd section, I'll reveal the smart hydration strategy, the scientific way to restore deep sleep with practical, easy-to-implement steps. Now that we know the mistakes to avoid, it's time to put together a smart plan that helps you sleep through the night uninterrupted while maintaining kidney and bladder health. I call it the smart hydration strategy. It's not just drinking water randomly, but organizing the timing and amount of fluids throughout the day so you give your body the hydration it needs while giving the bladder a chance to rest at night. Step 1. Start your day with water. When you wake up in the morning, your body is in a natural state of dehydration due to hours of sleep. Drinking 2 glasses of lukewarm water immediately upon waking helps activate the kidneys and stimulate the body's detoxification process, while balancing body fluids from the start of the day. Step 2. Regular hydration throughout the day. Instead of drinking a large amount at once, distribute water in small portions every hour or 2. This method reduces the burden on the bladder and prevents sudden urine accumulation. For example, a small glass every hour is much better than a whole liter at once. Step 3. Increase hydration in the first half of the day. Try to get 70% of your daily fluid intake before 4 p.m. This gives the body enough time to process the fluids and eliminate them before bedtime. For example, if you need 2 liters of fluids per day, try to drink about 1.5 liters before the afternoon and the rest lightly after that. Step 4. Gradual reduction. After sunset, after 7 or 8 p.m., gradually reduce fluid intake, especially diuretic drinks like tea and coffee. Step 5. Pay attention to hidden fluid sources. Many people forget that some foods contain a large amount of water, such as soup and juice-rich fruits, watermelon, oranges. These count toward daily fluids, and if consumed heavily in the evening, they may increase your need to use the bathroom at night. If you feel thirsty before bed, take only small sips instead of a full glass. By following these steps, you'll give your bladder a chance to rest during sleep, and you'll notice that the number of wake-ups gradually decreases. In the fourth section, I'll share a simple bladder exercise that helps increase its capacity to hold urine for longer periods, reducing your need to wake up even if the kidneys produce some urine during the night. Now, my dear friends, after we've adjusted hydration schedules and organized fluid intake, it's time to strengthen the bladder itself. Just like any muscle in your body, the bladder can be trained to become stronger and more flexible. This will help you reduce bathroom trips, both day and night. The idea is simple. The more you train the bladder to hold urine for longer, the more its capacity increases, and it will send urination signals to the brain more slowly instead of responding at the first feeling of fullness. How to apply the exercise. 1. Start with observation. On the first day, notice how much time passes between each bathroom visit. Don't change your habits, just observe and record. Example, if you go approximately every 2 hours, that's your baseline on which we'll build the exercise. 2. Gradual increase in time interval. If the duration is 2 hours, try to delay bathroom entry by only 10 to 15 minutes at first. Don't try to suddenly jump to 3 or 4 hours because the bladder needs time to adapt. 3. Dealing with the sudden urge to urinate. When you feel a strong need, try to distract yourself with something else. Slow walking, deep breathing, or sitting and relaxing. These techniques help calm the nerve signals coming from the bladder. 4. Persistence and perseverance. Repeat this exercise daily, and over time you'll notice you've become able to increase the duration between bathroom visits, from 2 hours to 2.5, then 3 hours or more. Important note, don't try to hold urine excessively or painfully, as this may cause kidney pressure or infections. The goal is safe, gradual progress, not exhausting stubbornness. And here come the supporting techniques that are considered the high-performance tires for the protocol we've started. After learning how to control hydration, these techniques will enhance results and ensure the bladder works at its best. Technique number 1, double voiding. Make sure the bladder is completely empty before sleep. Go to the bathroom, sit, relax, wait 30-60 seconds, then try to urinate again. The small additional amount of urine may be the difference between peaceful sleep or waking at 3 a.m. Make it a daily habit before bed, and you'll notice the difference in your sleep. Technique number 2, gravity elevator. 2 hours before bed, raise your legs above heart level while reading or watching TV. Use pillows or place your legs on the couch. This way, gravity helps return fluids from the feet and legs to the bloodstream before sleep, allowing the kidneys to process them better and relieving pressure on the bladder during the night. Also, wearing compression socks during the day enhances this effect and prevents fluid accumulation. Technique number 3, salt control. A small morning pinch is beneficial, but excess salt increases the need for water and stimulates. Nighttime urination, processed foods, sausages, and ready meals are full of hidden salt. Cooking at home gives you complete control, reduces salt, improves blood pressure, and relieves bladder pressure. In the 5th section, we'll talk about Kegel exercises for men and women, which play a fundamental role in supporting the bladder and controlling pelvic muscles, significantly reducing the nighttime urination problem. My dear friends, you may be surprised when I tell you that one of the most powerful means of controlling the bladder and eliminating nighttime urination is neither medication nor surgery. It's simple exercises you can do anywhere, even while sitting or lying down. Yes, these exercises are called Kegel exercises, and they're designed to strengthen the pelvic floor muscles, the muscles that control urine flow, support the bladder, and even positively affect marital life. First step, identifying the right muscle. Many people think they're performing the exercise correctly, but they're actually tightening abdominal or thigh muscles. To know the required muscle, try to stop urine flow while in the bathroom. The muscle you used here is the same one we'll work on in the exercise, but an important note, don't make this test a daily habit during urination. It's only for discovering the muscle because repeating it in the bathroom may cause problems. Second step, performing the exercise, sit or lie in a comfortable position. Tighten the pelvic floor muscle as if you're preventing urine or gas from escaping. Hold the contraction for 3 to 5 seconds, then relax for the same duration. Repeat this 10 times. You can start with 3 sessions per day, each session 10 repetitions, then gradually increase duration and strength. Third step, consistency. Kegel exercise results don't appear in a day or two, but with consistency for 2 to 3 months, you'll notice clear improvement in bladder control strength and decreased nighttime wake-ups. Additional tip, you can combine these exercises with the bladder training we discussed earlier to get the best results. These exercises also have additional benefits, especially for women after menopause and for men after age 50, as they help improve blood flow to the pelvic area, positively reflecting on general health and marital life. In the 6th section, we'll talk about smart nutrition to support bladder health and reduce nighttime urination, and how some foods and drinks can help you while others may worsen the problem. My dear friends, you might be surprised if I told you that what we eat and drink during the day, especially in the evening, has a direct impact on bladder activity during sleep. Some foods and drinks may make the bladder more sensitive, increasing our bathroom visits at night, while other foods help calm the bladder and improve its function. First, what to avoid in the evening. 1. Caffeine-rich beverages, coffee, black tea, energy drinks, and even some sodas. Caffeine doesn't just stimulate the brain, it stimulates the bladder too, and increases urine production, so it's best to stop consuming them after the afternoon. 2. Carbonated and sweetened drinks. Gas and excess sugar may irritate the bladder wall, in addition to increasing thirst and bringing larger amounts of fluids into the body. 3. Very salty foods. Excess salt makes the body retain water, then try to eliminate it later, usually at night. 4. Very spicy foods, or those full of strong spices. These foods may increase bladder irritation in some people, especially those with sensitivity or minor urinary tract infections. Second, what's recommended to support the bladder. 1. Vegetables rich in magnesium and potassium, such as cucumber, cooked spinach, zucchini, sweet potato. These minerals help regulate muscle contractions, including bladder muscles. 2. Low acidity fruits, such as pears, watermelon, bananas. They're gentler on the bladder than citrus fruits like oranges or grapefruit, which may irritate it in some people. 3. Soothing herbs. Warm chamomile or mint tea before bed may help calm the nerves and bladder at the same time. I want to end our talk today with a message to everyone listening right now. Restoring your sleep is possible, and every peaceful night begins with just one step. Let me tell you a true story. Saeed, a man who loves working in his workshop and fixing things, was waking up several times every night and became tired and frustrated. After just 2 weeks of applying this method, he called me smiling for the first time in years and said, "Doctor, last night I slept 7 uninterrupted hours. I can't remember the last time I got sleep like this." He added, "And this morning my hand didn't shake while working in the workshop. I feel alive again." This isn't a fantasy story. It's a real result that can happen to you too. Your sleep isn't a luxury. It's a necessity for your body, mind, and spirit. Here's the practical plan before you, step by step. 1. Advance hydration. Drink most fluids in the first half of the day. 2. Smooth landing. Gradually reduce after 4 p.m. and focus on a light, balanced dinner. 3. Stop at the right time. Respect the 2 hours before bed without fluids. 4. Support your body. Apply double voiding, elevate your feet slightly, and practice simple pelvic exercises. 5. Control salt and food. A pinch of salt and a few drops of lemon in the morning, and avoid foods and drinks that irritate the bladder at dinner. Now you have the knowledge, tools, and ability to restore your nights. It's in your hands. Don't surrender to fatigue or accept that your life becomes a prisoner to nighttime interruptions. Finally, I want you to remember something important. Sharing your experience helps you and helps others. Write in the comments how many times you wake up during the night. No shame. We're a community that fully understands what you're going through. As soon as you share, you've taken the first step toward peaceful sleep and a more active life. Remember, every peaceful night begins with one decision. Your decision to apply this strategy starting today. You deserve this sleep, and you deserve to feel alive again.